The number one obstacle for hospitals not moving health equity forward: resources. We can provide the seed money, the infrastructure, we can help with expanding projects, and of course to repeat these pilot programs. But we have a lot more to offer, and we've already talked about over this last day the benefit and the value to convene and to collaborate, to share intel, to bring people together. All of these things that we are known for in our community. Make sure that we are flexing those superpowers within your organization. So as you're starting to look at health equity and is it something that belongs in philanthropy, we always have to kind of test it with these two things: the organizational priority and of course the donor interest. So first, let's start with the organizational priority. We know the patient impact that it can have, but we also know that it has this business expertise here. When we look at now, health equity is costing $320 billion a year. And that number is expected to grow, if we don't do anything about it, to $1 trillion in 2040. So clearly it's on the radar of every one of our healthcare organizations. And we know that we are starting to do something about it. We have about 84% of our hospitals are doing surveys to identify determinants of health, and about 70% are advancing one, if not more, initiative to address the social determinants. So now we need to look at it. Do our donors care? And I know that we have been asking ourselves this for a while, and absolutely. And if you are not reading in the paper, hearing it on the news, please connect with me. I'll show you a lot of information of donors that are very interested. So if we look at healthcare funders in general, if you look after George Floyd, after COVID, more than 80% have said that they have changed their interest into health equity. 40% are adding programs of what they're supporting now. Corporations, I get giddy about this too. It's this beautiful space now that $1 billion are being spent in ESG, environmental, social, and governance programs, and the hardest that they can figure out, that they can't figure out, is actually the social. And you can see that about 44% have increased their giving at least by 25%. And this will continue. What a great partner for us to have in our community. Even the government wants philanthropy at the table. They see the value and the impact to have not only nonprofits, but philanthropy there to magnify the difference that we can make and the impact, the connections that we do have. Individuals. You're seeing this from the mega donors down to the annual donors. They get it. And for some organizations, they're even pressing the issue if the organization is not there. Even into this collaboration, we've heard that this week, of joining together with others to making sure that we do have that holistic care for our patients and community. So our hospitals are tearing down these walls. So what an audacious project. If we're looking at, we were this 20% of critical care, now we're having to look at the entire pie. But what does that look like for philanthropy? For philanthropy, to me, it's exciting because where we were in the pie of philanthropists, about 10%, now it opens up opportunity for the health equity work that we're doing to find funders that may not be patients, that may not have been our typical healthcare philanthropist. This is a great opportunity to expand current relationships as well as a gateway drug into new donors. There are a lot of barriers, though, when we look into healthcare equity for philanthropy. And just a few things for you to think about. First and foremost, you and your team members and your ops people need to ensure that everything that you're doing, all of the details, so that you can explain it in inspiration and effectively. I heard this quote last week from a foundation board chair. Is there disparity in our community? Is there disparity in our take for granted that the people closest to you understand what is going on? We need to ensure that we're educating everywhere we can what's happening. And just like we wouldn't go out and talk about cancer in a very broad sense, let's make sure that we have very specific facts and figures and strategies where people can touch and hear and actually see and understand what we're doing. And lastly, make sure that when you're talking to your donors, that you don't begin with, what is the relationship with our organization? But your first question needs to be, what do you care about? What's important to you? We'll get to the organization. You'll be surprised, even if they're your current donors, you might find out what they're really interested in. So we have to remember that health equity is not this thing on the shelf. It's not this one piece of the pie. It's included in everything that we're going to be doing looking forward.